Hi friends, I've been working with rhinoplasty patients since last 20 years, and it has been a tremendous pleasure and a great experience and a learning curve to be doing working with different kind of noses. So we can probably say we have operated more than 600 cases of rhinoplasty in this duration, and most of our patients are happy because we have done optimal work depending upon our experience, our knowledge, and the demand of the patient. So personally, this is my choice to examine the patient and to see the patient, analyze him completely, and discuss the things what is possible, what is not. So whensoever rhinoplasty comes, it is not like that you ask on the phone and you get all the information correctly, and the doctor sitting here talking on the phone or representative of doctor talking on the phone can give you exact idea of what you need and understands completely on the phone what is your need. So let's talk about it, friends, why rhinoplasty is a difficult surgery, technical surgery, and why it is important. Obviously, it is important because it is the part of your face and the nose lies in the center point of your face. So whenever I look at your face, it goes straight into my vision and my mind catches some abnormality even if it is a bit less on the nose, and it destroys my first impression. So it obviously dents my courage and confidence too. So friends, when I'm talking of rhinoplasty, I must tell you, I'm proud to share that we are doing 20% redo cases of rhinoplasty. The rhinoplasties which has been performed before by somebody else or outside, and then we are correcting them. And technically, clearly speaking, this is a very difficult procedure because all planes are withered, all structures have been played with, and the nose what we get here is operated nose which has got high tendency of bleeding and getting distorted. But technically and through trainings and vast experience, we have gained enough of the confidence to operate on the raw nose which have been already operated, and it gives me immense pleasure to correct them. And when the patients enter in my cabin smilingly after the surgery, that doctor, now we are happy. Talking about that, most of the center would be very comfortable doing an implant or a silicone implant or any kind of proline implant on the nose dorsum. So let me talk about, just to augment the nose, any kind of implant is foreign body to your body. Your body is going to react vigorously and it is going to trying to throw it out. So when we use implant, then if there is a small bit of infection or folliculitis, your body will try to throw away the implant, taking it as a offending material. So whole of the rhinoplasty goes one side. Second thing, mostly because most of the center would try to do just the implant in rhinoplasty because it is easier procedure. The technically sound people, the experienced people, and ask any of the person who has been operating nose for last 20 years or so, he'll say anything taken from your body, the cartilage or the bone, it is better accepted, and in case of small amount of complication, it is better adjusted to your face, and it causes obviously less amount of deformity because your body is reacting less to them. So first, maybe the choice of few of the surgeon who are not technically sound or novice one. So when you are using this implant, you are creating maybe a bigger problems for the patient. That's why 20% of the patient who comes to me, half of them have got extrusion of the implant and deformity of the nose, which are difficult to correct. At our place, either we take cartilage from the back of the ear, which leaves no scar. Scar is on the back side of the ear, or we take the septum, the central soft bone of the nose, for the as a implant in place of implant, or in case of cases where the implant need of your tissue is more, we take it from the chest. So in my experience, friends, the implant is inferior thing and inferior choice for any kind of rhinoplasty. Just because it takes more expertise, it takes more amount of work, and it takes more of your OT time, it doesn't mean that we fall for a inferior thing or give our patient an inferior choice. So when I am a surgeon, I am a rhinoplastic surgeon, and I want to give the best of the result, which is my extreme effort to give best of the result to my patient. You can see our video on YouTube. Follow and subscribe us, then you would know what kind of different variety of nose and difficult noses we are dealing with. So 600, more than 600 nose is a big number in a career of a cosmetic surgeon, friends. So my preference is always some structure, some tissue taken from your body that has been used for the dorsal augmentation, for the formation of columella, for the LR support, to strengthen the LR valves, to make better shape of the nose and the tripod structure of the nose, even to sometime to increase the, this part of the nose, depressed part. So these all structures, when we work together, then only we are able to give the best of the result, even in case of redo rhinoplasty. Friends, redo rhinoplasty, mark that word, because most of the cosmetic surgeon will be skeptic, afraid of taking up the patient whose confidence on rhinoplasty has been already shaken by inferior work. So we are doing it, and we are expert in redo rhinoplasty. You can go through our page on Insta, you can go through our page on YouTube or wheresoever you want, and you'll find all the rhinoplasty surgeries we are dealing with great care and great affection to our patient, because they are turning to us with a great faith. So that is my very important job, to restore the faith and confidence of the patient in the procedure and in life. Thank you.